Good morning, everyone. Thank you so much for joining. It is the Thursday, October 27th Learning Collaborative for Zero Suicide in Colorado. Thank you so much for being here. I know in Denver today, the weather is quite dreary, so hope that you are somewhere cozy and warm. I'm gonna bring up some slides to get us started here. As per usual, if you could please put your name and organization into the chat, that's how we keep track of who's here. And if you're from a large system, please also feel free to drop your facility name in there too. If you've been on these learning collaboratives before, I'm gonna start to sound like a broken record with that attendance ask, but it's really helpful for us to know who's here and where you're coming from. If you feel so inclined, please also add your response in the chat to our check-in question. What's your favorite way to interact with water? Could be anything. I'm looking outside and seeing the snow, and that's definitely not mine because I don't love the cold. So I'm gonna go ahead and say stand-up paddle boarding or kayaking. I love interacting with water that way. Wow, a lot more ice skating than I expected to see. That's awesome. I wish I could do that. I'm terrified of blades on ice. Good morning, everyone. Thank you so much for joining the Zero Suicide Learning Collaborative this morning. We're just going to take a couple minutes to let everybody trickle in. As you'll see, folks are putting in the chat their name, their organization, and if you're from a large system, please also include the facility that you work at as well. And our little icebreaker check-in, what your favorite way to interact with water is. Floating in a lazy river, I love that. Good morning, good morning. Welcome to the Learning Collaborative. We're gonna wait just a couple other minutes to get started. Today we'll be hearing about improving care for LGBTQ plus patients as it relates to zero suicide. Again, please put your name and organization into the chat so we can keep track of who's with us today. Before we get started, we're also gonna take a brief moment to do a poll for the November Learning Collaborative and see what day and time will work best for y'all, since the next session falls on a holiday, the end of November. All right, I am going to stop sharing screen. Oh, sorry, Shonali, don't have audio. Let me know if that doesn't end up working out. All right, so I'm going to launch that poll for the November Learning Collaborative preference. Please let me know if that pops up on your screen. Are you able to access that? Okay, great, thank you. The options listed there are the Monday of that week and the Tuesday of that week, with 1 hour windows between 9 a.m. and noon. Let that poll go for another minute or so. If you're just hopping on, thanks so much for joining. Please put your name and organization into the chat before we get started here today. All right, it looks like about 2/3 of folks have responded to that poll. So I'm just going to give it another 30 seconds here. It looks like the Tuesday from 10 to 11 a.m. So the same time frame that we normally have, but move forward Tuesday is looking like that'll be the most popular option. So I'll send that out via email, adjust the calendar invite. Please keep an eye out for both of those things. I'll try and send out a couple reminders since we're going to be having to change things. Awesome. All right. Yep. So that Tuesday, 11/22 from 10 to 11 a.m. Immediately after the meeting today, I'll adjust the calendar invite so that's reflected on all of your calendars. And then the follow-up email, make sure that that's flagged as well. Thanks so much again for joining. Today, we will be chatting about affirming and culturally responsive care for LGBTQ plus patients with Stephen Hayden from Envision U. Thank you so much for being here, Stephen, and really looking forward to your presentation. I'm going to stop sharing and toss it over to you.
Great. Yeah. Thanks so much, Conlon. Good morning to everyone. Indeed, from a cold and wet morning here in Denver. Let me just go ahead and get everything set up here on my end. Yeah, hope everyone's doing well. Grateful to the team at the Colorado Department of Public Health and Environment for inviting me today and continuing to think about and prioritize the mental health and well-being of Colorado's LGBTQ plus community. All right, so just quickly for those of you who don't know who we are, Envision U is a nonprofit based in Denver. Our focus is on working with LGBTQ Coloradoans. So our work spans all four corners of the state. Um, our We do a number of different things. So educating the community, raising public awareness around LGBTQ, mental health and wellness concerns. We do that through community-informed initiatives, public awareness campaign. We encourage recovery. We know that seeking behavioral health support is one of the most difficult and important steps a person with a mental health condition can take. And we work to empower individuals to find courage to seek the support they need. I'm a person in recovery myself. I've been clean and sober for 17 years. At one point in my life, it had really struggled with debilitating depression and took a lot of courage to reach out and ask for help. And when I did, my life changed for the better. We focus on enhancing resources so that when folks are looking forward and made that decision to seek help, that they're able to find culturally responsive and affirming resources available to them. And to further that in, we have a comprehensive training program for mental and public health officials to improve their ability to work with members of the LGBTQ plus community. To date, we've trained more than 1,000 professionals around the U.S. on how to deliver great care to members of the community. And for those of you who are in public health, there's definitely a growing recognition that a one-size-fits-all approach to public health and mental health is not adequate, and so we know that from our research and bring that into this training. All right, so today, as Conlon mentioned, we'll be talking about the LGBTQ plus community. We'll start with an overview of the population and the size of the community, and then talk about specific concerns as it relates to suicide. So while the exact number of LGBTQ folks living in the U.S. is unknown, part of that is just, understandable concern about revealing a person's sexual orientation or gender identity on government surveys. Recent data from the Household Pulse Survey conducted by the Census Bureau indicated that about roughly 20 million adults in the U.S. identify as part of the LGBTQ plus community. This is much larger than what we saw in the 2010 census. So the number of people self-identifying as part of the community is about 9% on the sort of the larger household pulse survey. And then earlier this year, Gallup released a survey focuses primarily on Gen Z Americans. Let's see here. And in that survey, we were really surprised. About 22% of Gen Z identify as part of the LGBTQ plus community. So almost a double, actually more than double of that age group now identifying as part of the community. All right. Okay, right. So, now that we've begun to, think about sort of the size of the community, I'd like to call attention to behavioral health concerns facing LGBTQ folks, beginning with suicide, given the focus of this call and the Zero Suicide Initiative in Colorado. It may come as no surprise that LGBTQ individuals are vulnerable to suicidal thoughts and behavior. Certainly, that's true of the general population. And preventing suicide and enhancing resilience is clearly one of the most critical aspects of healthcare provision for LGBTQ patients. 45% of LGBTQ youth seriously considered suicide in the past year, and this is data from the Trevor Project, and 14% of youth attempted suicide in the past year. The 2022 Trevor Project report also found that those at highest risk for suicide are queer youth, transgender individuals, and LGBTQ people of color. So when you consider the intersectionality of identity, it is therefore it's a critical aspect of healthcare provision for this community. In addition to the LGBTQ youth and adult statistics, SAGE reports that 39% of LGBT older adults have had suicidal thoughts in the past year, which is impacted by the fact that this population is 2 times more likely to live alone and be single, and are more likely to face poverty, living unhoused or unstable housing, as well as experience poor mental and physical health. Building resilience in the LGBTQ plus community can set folks on a path to better mental health. Factors that strongly protect members of the community, especially youth, against spiraling depression and suicidal behavior include acceptance by family of origin. These are folks, parents, siblings, grandparents, having a supportive social network made up of LGBTQ friends, allies, and family of choice. That may be a phrase that could be unfamiliar to you. So it's commonly used among LGBTQ folks, this idea of family of choice versus family of origin. So that distinction is important to many people in the community. And then access to and use of LGBTQ inclusive medical and mental health. Fortunately, resiliency factors can be enhanced through access to that affirming counseling and therapy, medical care, and LGBTQ specific resources. And finally, there are no LGBTQ specific screening mechanisms for suicidality, as you all know. However, because LGBTQ people are more at risk of medical and mental health concerns, professionals should have reliable systems for routinely collecting information on sexual orientation and gender identity of their patients, and then using that data to inform best practices. So in this slide, we can also see significant health disparities faced by individuals in the community with respect to substance use. Among LGBT, lesbian, gay, bisexual individuals age 18 or older, close to 6 million or so reported a substance use disorder. Depending on the research that you see, it ranges anywhere from 18 to 25% of the community have a diagnosable substance use disorder. In our own research, the state of the LGBTQ community in Colorado, which was released at the beginning of this year, nearly 25% of Colorado's community had indicated problematic substance use in the previous 30 days. So the numbers are quite significant. These numbers have increased since SAMHSA's last survey in 2018. So we're continuing to see a gradual increase in those numbers. And, to sort of compare that, it is a significant concern in our community. And when you compare that to heterosexual and cisgender data, somewhere between 9 and 10% of the straight community has been diagnosed with a substance use disorder, and again, nearly twice to 2.5 times greater in the LGBTQ community. So, why is it prevalent? Like, what are some of the contributing factors behind this? I'm going to walk through some of the most common triggering issues for LGBTQ folks, and as you all know well, the correlation between substance use and suicide risk is quite pronounced. So discrimination and social stigma, despite growing acceptance in the US, almost all LGBTQ individuals face some level of homophobia and discrimination. This comes from strangers, acquaintances, even friends and family. They often also face constant threat of workplace harassment, bullying, and even hate crimes. Thankfully, in Colorado, there's protection in employment laws for members of the community. That's not the case in many places in the US. There's a lack of support for members of the community, and as a result, often choose to remain in the closet. And we know that that's necessary for self-preservation and safety, but living this type of double life can create feelings of loneliness and anxiety. Those who do choose to come out often face rejection from family and friends. This is particularly true as we look at data from young folks and what that relationship looks like. One trusting or affirming adult in a young person's life who accepts them can make a significant difference in risk for mental health and suicidality. Internalized homophobia. So, whether or not families and friends provide acceptance, many members of the LGBTQ community suffer from internalized homophobia. This happens when a person when they self-identify with anti-gay stigmas. The result is often self-loathing and an inability to feel comfortable in one's skin. For those suffering from internalized homophobia, alcohol and drugs serve as an effective mechanism for silencing negative thoughts. When a person's drunk or high, there's this ability to, have that enhanced sense of euphoria. Two other things I want to point out is, historically, the gathering places for members of the community have been in bars and clubs, and that was really a safe space. But it's also can be really problematic for people who are in recovery or trying to find recovery. And lastly, when we think about the impact of issues in our community, the prevalence of anti-LGBTQ legislation and policy in this country this year has just been unbelievable. More than 300 anti-gay laws have been put forward and passed in the U.S. Anyone from city council to state legislatures, members of the community, especially young trans kids, are literally under attack by some politicians in this country. Not here to get into politics, but I will just say generally in our work, the thought of having a political agenda where young people are a target of your effort seems cruel to say the least. All right, so some of the additional behavioral health concerns for the community. So compared to heterosexual and cisgender counterparts, and if you're not familiar with the word cisgender, it's a person identifies as the gender assigned at birth. LGBTQ individuals are twice as likely to experience a mental health disorder in their lifetime and are over twice as likely to experience depression, anxiety, or again, as I mentioned earlier, substance use disorder. Unfortunately, while these behavioral health concerns exist at higher rates, in our own state of the state report, folks lack access to affirming care. 24% of the LGBTQ community in Colorado report that their income does not cover living expenses. And 36% identified cost as a barrier to seeking care, compared to about 12% of the general So financial concerns certainly are consideration for many of us, and it's particularly salient when you look at the LGBTQ community. In addition to the data seen on this slide, some additional findings from the Trevor Project and our own research found that 60% of LGBTQ youth who wanted mental health care in the past year were not able to get it. So when you think again about that correlation of mental health concerns, risk of suicide, and the inability to get access to care, and when folks do get access to the care, the question is it culturally relevant and responsive to members of the community? We know that LGBTQ youth are 2 times more likely to experience bullying, and transgender youth are more than 3 times likely to experience bullying than their cisgender peers. All right, so what are some recommendations for culturally responsive and affirming care? One thing that I'll note here is just our organization is moving away from this idea of cultural competence to culturally responsive. And we've made that switch to think about, this is an ongoing process of learning and commitment from people in public health and mental health to respond to individuals in the community in a meaningful way. So I'm sure many of you are familiar with the minority stress model. So when approaching the provision of culturally responsive and affirming care, it's critical for us to understand this concept of minority stress. Minority stress is the additional stress that members of marginalized groups experience because of the prejudice and discrimination they face, or the adverse social conditions caused by oppression and discrimination against members of marginalized individuals by the dominant social group and its systems. Such as the experience and expectation of prejudice, discrimination, harassment, microaggressions, and rejection. So the flow chart you see on the slide demonstrates how minority stress theory proposes that things like gender and sexual minority health disparities can be explained in large part as stigma, prejudice, harassment, and discrimination, and how those create stressful social environments that can lead to behavioral health problems in people who belong to one of these stigmatized or marginalized groups. Unfortunately, resiliency factors can be enhanced through access to affirming care, counseling, therapy, medical care, resources provided by public health departments. Um, Behavioral health providers and medical providers can use minority stress treatment principles when caring for this community. I'm going to highlight a few of those. Normalize adverse impact of minority stress. So this recognition that being a part of a community does lead to greater risk of the things that I pointed out earlier. Facilitate emotional awareness, regulation, and acceptance. So working with clients to feel both comfortable in a treatment setting is really crucial. Empower assertive communication. This is really important. Not only do we hear from members of the community that they're reluctant to come out to their medical or mental health provider, which of course creates the potential of not addressing certain concerns, and particularly around sexual health. So if we're not openly discussing who are partners in those environments, that could lead to misdiagnosis or the lack of education around certain considerations. Restructure minority stress cognitions in the work we do, validate the unique strengths of people from the LGBTQ community, foster supportive relationships, and affirm healthy, rewarding expressions of sexuality and gender. I've heard, in addition to my work at Envision, I'm a mental health therapist, and I've certainly heard from clients who have seen medical and mental health professionals where, their sexuality practices have been criticized by professionals, and of course, that is can be incredibly harmful and traumatic for folks. Now, again, it's crucial. It's not, this conversation is not just for behavioral health professionals, right, to be aware of these factors, but it's important for all of us who work to create policy and programs to support community health. All right, so it's also critical to consider intersectionality as it relates to minority stress. As you all know, intersectionality compounds minority stress among people of color, individuals living with disabilities and chronic health issues, immigrants and refugees, poor and low-income individuals, indigenous and two-spirit individuals, folks living in rural communities, and those from faith communities. As seen on this slide, transgender people of color are in fact at increased risk of experiencing transphobia, stigma, isolation, and rejection as a result of their multiple marginalized identities. In 2020, 44 transgender or gender nonconforming people were fatally shot or killed by violent means, and the majority of them were Black, Latinx, transgender women. And so we continue to see staggering numbers as it relates to violence against transgender and gender nonconforming individuals. All right, so by identifying and using language individuals use for themselves, you are affirming their identities and creating a safe and welcoming environment. On this slide, we have some recommendations so you can lead with purpose and have inclusive and affirming language as part of your practice. Ensure you use your own pronouns and introductions and establish your own identities and conversations with others. You should include affirming and inclusive language in all forms and documents as well. That includes, my name on the Zoom call has my pronouns. I include that in my email signature, just to let folks know that, I'm welcoming and supportive of gender diverse individuals. In the end, we always defer to an individual for what terminology to use for their identity. The word queer is a great example. It's a word that some in the LGBTQ community, especially the older generation, and I count myself among those, aren't necessarily comfortable using because of its association with being unsafe and stigmatized. At some point, early in my coming out process, the use of the word queer was a slur. But many youth are reclaiming it as a source of pride because they feel it better encompasses all their feelings relating to sexual and gender identity. So, regardless of age, it really comes down to just using the language that folks are comfortable with. And, I referenced that Gallup survey earlier, also appreciating that more and more folks are really identifying in a very fluid way. And so you may have people that you work with that present more masculine one time. They may use a particular set of pronouns at that time, and it may change the next time you see them. So what I can say in my own experience in the work that we do, that that fluidity, which I think is incredible that people are able to embrace that and not feel so inclined to have to check boxes. It's important to know that, we just need to respect who that person is and meet them where they're at on that particular interaction. All right, so this slide recommends some proactive steps that folks can take in order to better serve LGBTQ individuals. Other steps include introspection around and addressing our own implicit biases. This is really important work that no doubt we've all committed to. Understanding those biases allows us to commit to additional training and interaction with folks so that we can be better prepared to serve them in a meaningful way. Ensuring again that we're using affirming and inclusive language. We're not making assumptions about folks' gender, pronouns, or chosen name, or sexuality. Increased competency is critical given that LGBTQ individuals' lived experiences within behavioral health spaces are often poor or in some cases traumatic. Referencing again our State of the State report, which was produced in conjunction with Omni Institute and the Denver Foundation. Nearly 600 Coloradoans were surveyed, and we found that half the respondents have primary care providers who are not LGBTQ affirming, and 17% were unable to be referred to appropriate and competent care services. Not surprising, care that lacks cultural responsiveness and affirmation exacerbates concerns already possessed by LGBTQ individuals and perpetuates distrust in the medical field. And, for so many years, there's been a significant mistrust that exists. It wasn't until 1973 that the diagnosis of being gay wasn't considered a mental health disorder. For those of us who were around, especially doing work in the late 80s into the 90s, those living with HIV and AIDS did not receive ideal care from both the systems delivering care, but also from many public health departments. And we've seen even a lot of stigma around the most recent concern as it relates to monkeypox. And how do we talk about illness? How do we talk about the prevalence of issues that may be more prevalent in this community without further distancing somebody's ability to access care or interact with departments that are set up to serve everyone? Right. So thinking about administrative inclusivity, it's critical that LGBTQ providers, individuals providing care, have forms that list sexual orientation, gender identity, that allows folks to enter in maybe their legal name that often appears on their ID and insurance card, but giving a space for that person to identify the name and pronouns they prefer to use, and relationship status, right? So there's still often forms that I see where it's pretty gendered, right? Married and spouse, male and female, and so it doesn't give one the ability to self-identify. The two best ways to ask are either a blank space to self-identify or a multiple choice option along with a space to self-identify. So just giving folks choice. Survey best practices find that a multiple choice format that provides a variety of answers, man, woman, non-binary, trans man, trans woman, as well as an open space to self-identify, resonates really well with respondents in the research, as the identifying of multiple diverse gender options along with a space to self-identify signifies an openness towards a variety of genders. This may encourage more honest self-identification than when only providing a blank space where the openness to diverse genders is unknown. Additional components of an LGBTQ practice and administration include signage and posters signaling inclusiveness, inclusion of sexual orientation and gender identity, and non-discrimination statements, along with affirmation of LGBTQ clients on materials, hiring of staff, and general staff training. So, I often think about the practices that I work with, and, the focus understandably is how do we deliver great care to all of our patients and clients, and what kind of environment are we creating for our colleagues, right? So it's safe to say that most of us in our workplace have colleagues who are part of this community, and how are we supporting them so they feel welcome within that workplace? In terms of training, one thing to ensure is that this training is not only given to providers or direct care clinicians, but to any staff who may be interacting with the client in some way. So we think about folks who conduct intake interviews, receptionists, aides and assistants, HR staff, billing staff. This ensures that that staff across the board have the skills and training to use appropriate language, maintain a non-judgmental attitude, avoid unnecessary questions, and understand the importance of non-disclosure. Client is working with billing to determine insurance issues, for example. Billing staff should have the skills to ensure they're using proper language and can identify potential areas where they may be able to support the client in better understanding and navigating their insurance coverage. So, in my own work, we had that conversation early on that, your name appears a certain way in the medical record. Um, Certainly, the bills that go to your insurance company may use a name that is one that you no longer use. But yeah, just having those frank conversations so that the people we serve understand the reasons we are doing the things we're doing. And then in my interactions with them, of course, I respect the names and pronouns that they want us to use. All right, so suicide prevention methods. So beyond the previously discussed recommendations that I've outlined regarding culturally responsive and affirming care, initiatives such as Zero Suicide exist as well, as each of you know. As an organization, Envision You is committed to this initiative's belief that suicide death is preventable and that prevention must be done in part through transforming healthcare and behavioral healthcare systems for patients. This prevention also takes the form of seeking population-specific information about suicide risk and protective factors, which is important in order to prioritize suicide prevention and intervention efforts for LGBTQ plus Coloradans. This effort will also contribute to improving data collection and reporting of LGBTQ specific prevention needs and trends, which, if you recall, was a stated need at the beginning of my presentation when discussing the gaps in the data as it relates to the LGBTQ population as a whole. Research notes noted earlier demonstrates multiple factors that are associated with suicidal behavior among LGBTQ individuals, including isolation from family and peers, those early attachments with family and trusted caregivers, a history of mental health issues, and victimization, being the target of bullying, being abused. We definitely see rates of this happening at much higher levels, especially on social media. All of these risk factors stem from the stress created by living as a stigmatized minority. Even today, with increased awareness and social acceptance in the US, lots of folks are still contending with that harassment and bias that exists in so many different places that we show up and live our lives, right? Whether it's work, with friends, houses of worship, schools, places of public accommodation, including shelters for the unhoused, and healthcare settings. So we all have the opportunity to work together to ensure that these spaces are welcoming to everyone. Anti-LGBTQ attitudes can be internalized, as we talked about earlier, just leading to more stress and potential for suicidal thoughts. All right, so as I come to the end of my formal presentation, just providing some resources that are available. These are the Center on Colfax is one example of a community center. There are a number of these that exist across Colorado. Queer Asterisk, which is where I have an affiliation for my clinical work, provides mental health services to members of the community. Youth Scene primarily provide services to queer youth of color. So they're doing some great work. They're based in Broomfield, but provide services across Colorado. And Transgender Center of Rockies, again, based in the Denver area, but do work across the state. here are some additional resources that are available that are specific to this population. I believe Conlon is going to share the presentation afterwards, so you'll be able to see those. And then lastly, on this slide, you have contact information for my emails on there. Please feel free to reach out if there's anything that we can support you in terms of resources or training. Um, the last thing is I want to mention You Flourish. So You Flourish is an initiative that Envision You has been working on over the last couple of years. And it is a smartphone app that will be launched nationally in the spring of next year. And what's exciting about this is the focus is on connecting members of the LGBTQ community to affirming care and resources, which would involve information related to the Zero Suicide Initiative, the ability to build a peer network of people with shared identities and experiences, and then wellness content that's going to be developed and created by members of the LGBTQ community for the folks that use the app. So really excited to be able to expand our impact and reach to support the well-being of our community. Thank you so much. I'm gonna go ahead and stop sharing my screen and happy to answer any questions you have. I imagine there may be some in the chat if you feel comfortable putting them there, or I'm happy if you want to unmute.
Thank you so much for such a thorough and nuanced presentation, Stephen. That was really helpful. And thank you for the work that you do in this area in education. Otherwise, I just want to say it's really appreciated and heard. Thank you so much. Lots of comments in the chat coming through with similar sentiments.
Thank you. I know it's still early. Maybe folks, need another cup of coffee. I certainly do. But yeah, if you have any questions, please put those in the chat.
Awesome. Lots of thank yous, great presentations, super helpful information. I think at the end of the day, a lot of this cultural responsivity in this area gets back to meeting people where they are. Like with all things zero suicide, it should be patient-centered. And with your zero suicide implementation team, like this is an area where you can say, hey, are we including people with lived experience in this area and the quality improvement initiatives are we doing? Are we accounting for resources and who we refer out to? Are we holding our community partners to these standards too? It's not necessarily just your system, like these are community issues. And I really appreciate the kind of systemic and community level factors that you put in the presentation too, Stephen. I think that was really powerful. So thank you so much again.
Yeah, it's really my pleasure.
I dropped in the chat at one point, it's probably long gone now, the link to the Suicide Prevention Commission's recommendations for LGBTQ 2S plus youth. And that is a very rich set of recommendations for a health system, a community group, anybody interested in better supporting youth who have an identity that is a part of this community. So definitely encourage you to check out that document for a whole host of good information. And then in a follow-up email, I will be sending out some of those compiled resources that Stephen shared, a variety of other trainings available to anybody that are free of cost and on demand in this area. So please keep an eye out for that. Also wanted to flag again really quickly, the next meeting, given the poll that was sent out at the beginning, will be on Tuesday, November 22nd at 10 a.m. Mountain Time. So again, right after this meeting, I will be adjusting that calendar invite and sending that out, along with, again, a compilation of resources. So please feel free to check that out. Thanks again to Stephen for that amazing presentation. The recording and slides and Stephen's contact information will also all be sent out after. I'm going to hang out in this Zoom room. Uh, if you have any other specific concerns for your context or about this presentation, but yeah, thank you so much for joining today. We had one question come into the chat from Elise, really quick here. Was it 320 laws that were proposed against this population nationally in reference to that one statistic you shared, Stephen?
Yeah, so halfway through the year, so we don't have recent data that includes August through present, but midway through the year, we had seen more than 300 laws, varying from book bans to banning the use of the word gay, outing young people from teachers and others to parents, um, denying gender affirming care for young folks. So there's been a significant push by many people in the sort of political sphere targeting this community. Just as a comparison, in 2018, there were 41 laws put forward, and again, 2022 to see that there's been more than 300. And I'll say it's hard to believe that we're here in 2022 and seeing sort of the it feels like we're taking some steps backward, and no doubt that's true in other areas as it relates to physical and mental health concerns.
It's very concerning. And I know like our mentality as the Office of Suicide Prevention is that supporting and affirming these identities in this community is suicide prevention. Even simple things like respecting pronoun use, it's respecting humanity and how folks want to be recognized and affirmed. So yeah, thank you so much again, Stephen, for all of this information, and thank you all for joining. Hope you enjoy 10 minutes back in your day. But again, I'll be hanging out in this room, and thank you so much again.
So I would really appreciate your time and interest in the topic. Thanks, Colin.